Dr. Nagalakshmi. Today I'll be talking about vancomycin. So vancomycin belongs to a group known as tricyclic glycopeptide. Now this vancomycin is highly sensitive against gram-positive bacteria. Now what is the mechanism of action? Now this vancomycin is sensitive against Staphylococcus, Enterococcus, right? Clostridium difficile, diphtheroids, diphtheриal infections, right? Now this Staphylococcus, it could be MRSA or methicillin sensitive Staphylococcus aureus or other strains of Staphylococcus. Now, what is the mechanism of action? As I said, now this drug is highly sensitive against gram-positive bacteria. When you see the bacterial cell wall of a gram-positive bacteria, this has a cytoplasmic membrane. It has a periplasmic space which is present. And it has a peptidoglycan layer. Now what is this peptidoglycan layer? This peptidoglycan layer is nothing but polymers of N-acetyl muramic acid and N-acetyl glucosamine. Now this N-acetyl muramic acid and N-acetyl glucosamine are synthesized by an enzyme known as peptidoglycan synthase. Now, if this peptidoglycan synthase is inhibited, this prevents the synthesis of this components, and further polymerization of this components. Now, as a result of this will weaken the cell wall. As it weakens the cell wall, the structures start extruding out, eventually resulting in bacterial cell death. Okay, so that is, it is more effective against gram-positive bacteria. Now let's see the dosage, the route of administration. Now when you see the dosage and the route of administration, okay, the drug can be given intravenously, it can be given orally. The disadvantage of this oral route is the less bioavailability associated with it. Okay, so the intravenous route, the drug is available in form of 5 mg per ml or 10 mg per ml IV vials, dosing from 500 mg to almost 1.5 to 2 gram. Okay, it is given intravenously based on the site, based on the requirement, based on the severity of infection basically. Okay, and it is administered 8 to 24 hours. Based on the patient's age, renal function, all of these are decided. Then when you talk about the oral route, because this drug has a very low systemic absorption. Because of this property of very low systemic absorption, it can be used in intestinal infections like enterocolitis, Clostridium difficile infections. So these are available in dose of 125 mg, 500 mg or even 250 mg capsules are available. It is also available in form of solutions. So because of the low systemic absorption, the adverse effects associated is quite less. It is excreted through the kidneys. So the dose adjustment in patients with renal disease is important. In addition to this, what all we should know is 1. It is bactericidal. Second, this drug has a very rapid onset of action. That is, as you finish the infusion, the drug immediately starts its action. That fast is the onset. And third, you should remember it is 55% protein bound. Right? Then it is excreted, 75% of it is excreted through the kidneys rest through the feces. Okay. Then it is excreted unchanged, so does not cause any metabolism. When you talk about the half-life is a biphasic elimination occurs with this drug. That is, the initial half is quite quick. The second half takes about 4 to 6 hours. Right? Then, what are the uses? The indications for use of vancomycin. The FDA approved indication, I would say, 1. All of your staphylococcal infections. It could be septicemia, it could be skin infections, it could be orthopedic infections, it could be soft tissue infections, it could be LRTI, or in enterocolitis, staphylococcal enterocolitis also, this is the drug of choice. Then, in addition to this, it is used in endocarditis. Endocarditis secondary to staphylococcus or enterococcus or diphtheroids. It is also used in Clostridium difficile associated diarrhea, or it is also associated with pseudomembranous enterocolitis. Enterocolitis. The other off-label uses, to remember, it is basically used as a surgical prophylaxis. Okay, any community associated infections, bacterial meningitis, surgical site infections, intra-abdominal infections, community acquired pneumonias, catheter related infections. Right. Then let's talk about the adverse effects and the contraindications. First, let's talk about the adverse effects associated with IV vancomycin. 1. Because of the renal clearance, it can cause nephrotoxicity in patients with compromised renal function. Then it causes hypersensitivity in susceptible individuals. Okay. Then there is something known as red man syndrome, also known as vancomycin flushing syndrome. So what these patients with red man syndrome usually present with pruritus, rash involving the face, neck and upper extremities, and flushing. So this usually appears within 4 to 10 minutes of the intake of the drug or shortly after completing the infusion. Okay, so as it occurs, these patients present with these symptoms and it can progress to hypotension. There could be further angioedema which can occur. This is very common in children and patients younger than 40 years. So these can be treated symptomatically with histamine and other supportive therapy. In addition to this, it can cause a rare condition known as DRESS syndrome. Now, what is this DRESS syndrome? DRESS syndrome is nothing but drug-associated rash, eosinophilia, and systemic symptoms. These are the most common side effects. Then, let's talk about the adverse effects with oral vancomycin. So, with oral vancomycin, the patient can have abdominal pain, he can have nausea, he can have associated GI upset symptoms, and many of it usually subside symptomatically. Then, Very rare side effects associated with vancomycin is ototoxicity, thrombocytopenia, which can occur. Then let's see what are the contraindications. The contraindications for vancomycin is 1. Patients with compromised renal function, especially elderly individuals. Okay. Then, because the intensity of toxicity is very high in these individuals, it is a category B drug. So, the use in pregnancy, category B drug when given orally, category C drug when given intravenously. So, the use of this drug is not regularly used unless the benefits outweigh the risk. Then, in breastfeeding individuals, because this drug is excreted through breast milk when given intravenously. Although oral route has very minimal systemic absorption, limited excretion is noted. But when given systemically, when given intravenously, this drug is likely to secrete through breast milk. So this has to be taken into mind. Renal impairment, as I told, and drug interactions. Now, what are the drug interactions associated with this vancomycin is one important thing. So, the drug interactions is when it is given with other nephrotoxic agents like aminoglycosides, amphotericin. Patients is receiving IV contrast. So in these individuals, you should be quite cautious giving vancomycin. Fine. So this is about vancomycin. So any doubts, do comment down. Do let me know if you want any other topics. Thank you.